with all of you. Right, so people who are new, people who have been there with us throughout the journey, who have joined in between, come what may, a very good morning, a very good afternoon, and a very good evening to all my lovely students. Good enough. So as students are joining, what are the things that 𝐀𝐝 Academy has in store? Sidhu, good afternoon. Kalpana, Sidhu, Bangalore. Kalpana, Manipur. Neethu George, good evening. Right. How is your preparations and all going? Yes, it's all doing good. Shiny Sojan, good afternoon. Nice to see a lot of people who have been there with us. Okay, so Anat Sato, good afternoon. Sharat Chandran, good afternoon. Nice, a lot of known names. So which is quite what you would say to ease all those things. So because you have been there showing, rendering that support, that is very, very important for us. Okay, because the kind of support that you have been showing is the growth that we have had with the updates that we have come, with the number of other live sessions that we have come. It's all because you have been there. Cut support. What happens? We also have that kind of eagerness to come up and make sure that we are doing a lot of things in order to enhance each one of you to reach to your dream destination. Good enough, Kavita Balaji, good afternoon. Shiny VS, good afternoon. So just a reminder, in few days to come, Neethu Madam is going to come your way. So make sure that you're all clocking in this Friday, 10 p.m. at the very same page that you're watching for her writing depiction case note. And please be aware of it. These are all self-prepared materials. Okay, that's what we always indulge when you're investing. We always believe on the aspect of investing. It is on the aspect of time, because you manage all those time and you come. So we never wanted you to leave empty-handed. So 𝐀𝐝 Academy always have self-prepared materials, which is always on the aspect of, we try to create it on the aspect of how an exam perspective or how it will be oriented with regards to an exam point of view, so that you will never feel that the time that you have invested is never a waste. Shiny VS, good afternoon. Rajni Vinu, good afternoon. A new name, Rajni. Atira Sally, good afternoon. 𝐿𝐶 James, good afternoon. Anija Devdattan, good afternoon. So I would always request all of you, if you have not yet liked our page, please do like the page. If you have not yet followed, please do click the follow button. If you have not yet subscribed to our channels, please do click the subscribe button. Now, why all these? So that you will not miss, even though with your busy schedule, it just pops into your gadget saying that, okay, you have this class happening. Shivanya Palakkad, isn't it? Good afternoon. Anjuna, good afternoon. And we've just pinned the social media platforms that we are there. We are in WhatsApp channel. We have Telegram pages. We have only 2 Telegram pages. Please be aware of it, okay? One is an exclusive reading Telegram page, and the other one is an official 𝐀𝐝 Academy Telegram page. There is no other Telegram pages that we have. So if somebody is contacting you saying that this is that page, no, we don't have. Anything that we want to come and let you know will come straight in front of you. And Teresa George, good afternoon. So it's nice to see, some very, very, very familiar names and some new names as well. Divya Subhash, good afternoon. So if you have not yet, as I've mentioned, that is to show that you're all there supporting us. Because if we really look into our Telegram page, we are there hovering about close to 50K. And these are all present students. Okay. So if you have not yet joined, please do not hesitate, that you will never feel that you have been left stranded. There are a lot of insights. We do have grammar challenges. Shiny Rose, good afternoon. Now back to, as we have promised ever since 2024, we've been always trying to ensure that you're all there, hovering or getting that 8 minutes barrier. Kalyani Rajagopal, good enough. Shiny Rose, good enough. Sorry, good afternoon. Kalyani, good afternoon. Laisam, good afternoon. So today again back to square one. How are you gonna look into the aspect of 8 minutes barrier? Rajesh, good afternoon. See, most importantly that you have to always remember, see, these 8 minutes is not such a huge task to overcome. Now, the problem with you, you have to always understand, see, no matter whatever the exam that you're taking, the exams will always be a mix of questions. It starts from easy, moderate, and challenging questions. I'm not saying difficult, because difficult is not a word at all applicable to any one of you. Because these are all content that is going to come from what you already know. Okay? So the problem that you are always trying to is, you're trying to overdo. Overdo in the sense, it's not because that for any other reason, it's because you know a bit more of what it is. That's the only reason. Okay? So in order to crack that 8 minutes, I would always request you, see, especially in part A, okay, please always tell yourself, whenever you're practicing the material, you tell to yourself, see, the answer should be there in a synonymous language. That means the words would be, synonyms will be used. Okay? So you have to always underline the keyword that is there. Now what I'm talking about is, see, let's say question number 1. Okay? You underline, you skim the text, you underline the question, and still in that quick, this thing, you're not able to recall it. What I want you to do is skip that question. Skip that question. Let's go to question number 2. Again, underlining keywords, you're not able to skip that question. 3, okay, this is there in A, right A. 4, this is, I don't understand. Okay, now what I want you to tackle to reach our goal of 8 minutes, I want you to start skipping those questions which are not in a position to find the answers quickly. Okay, now when you skip, okay, don't feel the pressure. See, I'm not saying don't write the answers, finish the 20, whatever that you could find easily. Then after that, you go back to the ones that you have missed. Mark my words, by that time you would have finished your 20. These keywords that you have missed initially, you would have gone through in front of you. So then next time it is easy for you to find those answers. Okay, now you have to always give that respect to the question paper. You have to always treat that question paper with the utmost respect, because that question has a pattern of all these 3 types of questions. Maybe the first question that you're looking for is a challenging question for you, but when you waste a lot of time trying to find the answer frantically, you would not, because you're getting more tensed. Okay, so that is the thing that you have to start. So today, in order to tackle that 8 minutes of time, I want you to skip the questions. If you're not able to find it initially, do not panic, skip. Tell yourself, you have to start talking to yourself on the aspect internally. Say, see, it might be a difficult question. Don't worry. Next, initially, okay, as when you practice this, it's going to be a routine for you. Why? So not only that you will attend all the 20, but also you will find the answers for 20 in that time. Understood? Because you're wasting a lot of unwanted time thinking, okay, where I know somewhere. No, relax. It will come in front of you. Because the 20 answers to all these questions are spread across the 4 texts. And when you go through the text at least once, you will get that answer, because the more you go through, you will find the answer. Understand? And always see whether that keyword, see, next tomorrow, or let's say keywords, okay, those are very, very, very important. You still don't, because if you are not able to beat that time, that is because your skimming is not proper, because you read a lot of, or you underline a lot of big words, which is not going to have any benefit into you. Okay, so today I spoke about the importance of skipping the questions, as well as the importance of, again, because what we teach is what we come and give you the focus, because we know that that is all what is the most important thing in order to get the part A 8 minutes. All right, Fancy, good afternoon. Dangasudha, good afternoon. Divyajish, good afternoon. Bhagya, good afternoon. Rashna, good afternoon. So I hope today is that small tip you would practice. Of course, you have to, okay? Make it into a routine. Tell yourself, see, if I don't find the answer, no problem. Read the next question. Next one I did, no problem. I'll come back and do. But by that time you finish the 20, you would be, let's say, initially the easy one, because you have to always tell yourself 50% of your answers would mostly be easy. So out of 20, 50% means 10 marks you have already got. Okay, now go back. By the time you reach those 10, it will be spread across all those given 4 texts. Your other answers will come in front of you. Or even when you're searching for the other answers, if you are not tensed, if you're keeping yourself very, very, very open, you will see that, oh, I know that this is the question for the previous one. You will write, you will find the answers. Understood? Shiny is saying, okay, precious advice. Thank you very much. Please do. So I hope whatever that I've told you, you found it or you feel it can benefit you. If so, please do let me know. Do you think that it can benefit you? Because most of the students get stuck with those questions, isn't it? Monica Vegas, good afternoon. Very, very, very good afternoon. Right. I hope you would do. Okay, because as facilitators, we're only able to tell you. You are the absolute people who are gonna do it, isn't it? Jilmi, good afternoon. Right. I think now students have all come. So what we will do, we'll go back to what we are supposed to do. Sorry for the delay. Do not worry. I do understand, because the exam date is right next to you, isn't Monica? Good enough. So what we'll do into the part B. So the material will be popping up on the screen. So as soon as the material pops up, do not waste your valuable time. Give that importance, saying that, see, I'm here for that purpose. I am gonna find my answers. Okay. Reshma, hi. Simi Ajay Qatar, good afternoon. Thinking to join one time due to busy schedule. Cannot attend. On time, I'm sorry. Monica, do not worry. I do understand. You have to have the right balance and all. So it's not point of getting yourself into a thing saying that getting tensed is. Relax yourself. Do. Everything will come here. Jamis Joseph. Hi. New name. If there is anybody who's attending the live for the very first time, please do let me know as well that you're attending and where you're from. Yeah, would be happy to know where you're from. All right, now the material will be popping up. There you have the material. Please do the material and then we will discuss. Okay, time I've just alluded, but so happy, Kalpana. You are the first to tell me that you've done. Tansy done, Neetu George done, Shiny V has done, Kavita Balaji done, Kalyani Rajgopal done, Rajni Vinu done. Good enough. Shivanya Nadish done, Palakkad, Anija done, Thangasudha done, Divya Subhash done, 𝐉𝐸𝐺 done. Good enough, good enough. 𝐸𝐺 done. 𝐺𝑉 is done. Good enough. So you have all said Rajesh done. You have all said done, 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 done. 𝐶𝐻𝐼 done. Please be kind enough to tell me what is your answer and where you got that answer from. Monica done. Sidhu done. Good enough. Sharad done. What is your answer? Where you got that answer from? Laisamma done. Good. Again, I want you to tell me what is your answer and where you got that answer from. Kalpana is the first one to say again. Kalpana, A from second para. Fair enough. Neetu George, A from second para. Those are the people who have recommended, isn't it? Good. Reshma, A middle. Monica Vegas, A from the fifth line. Okay, very specific on the aspect, fifth line. Shiny V is A from second para. Fair enough. Divya Subhash, A second para. Sidhu, A second para. Grishma Devasya, A second para. Nancy R, A middle. Shivanya, A second para. Shavit Biju, A second para. Okay, very unanimous answer. Kalyani Rajagopal, A middle. 𝐺𝐵 is A from middle. Anisha Devdattan, A from middle. See, if you have got any other answers, you do not worry. I have not told which is the answer, and it is not there. See, learning is a thing called whatever that you have got, it is our right to tell. Okay, that's called learning. Sharat, A middle. Tangasudha, A first para. Lysam, A middle. Okay, fair enough. Now, even though there are no other answers, so now let's go and see whether if it is A which is right, or is it going to be B, or is it going to be C. Ansivag is A middle. Shiny Sojan, A from middle. So the material will be popping up, and then we will be talking about. See, please understand, when you're doing part B, okay, you always have to remember three things. Read the question, underline the keywords in the question, understand the question. Very, 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 very important. If you don't, you have to always remember your answers have the possibility to make it different. Okay, now see, so what are the things that you have to do? What course of action? So action should be followed if significant airway risk is identified. So action, risk, identified. Those are enough for me. Okay. Now answer options. After this, you can read the paragraph and then pick an answer. But I'm a person who want to know what I'm searching for in the paragraph. So I read my answer option, underline the keywords in the answer option, and then I pick it up from the paragraph. See, the strategy for doing part B is called elimination method. So in order to do elimination method, you should know what are the keywords as well. So anesthesia must be deferred till the required tool and staff available. Next, sedation should be administered with utmost caution by an expert. Anesthesia should be given after airway risk is minimized. So these are the three. So two, they are talking about anesthesia. One is saying about a sedation. So even though, see the presentation style. Okay, that's what I was just trying to give. Now one is saying must be deferred. Deferred means you know what is the word deferred, isn't it? You change. Administered. You're going to administer, but it should be administered by an expert after the risk is minimized. So three options, three different things. Significant airway risk, so that is our keyword on the aspect of the main content. When procedural sedation or anesthesia is planned, the sedationist or the anesthetist must formally assess the patient's airway and document this in the patient's healthcare record prior to commencing procedural sedation anesthesia. So they are saying, okay, they should check all these things. These are the normal procedure. If this assessment indicates a significant airway risk, then the anesthetist or anesthetist must be present before sedation is given. So now they are not saying that sedation should be administered with utmost by the expert. They should be present is what they are saying. So slightly B is not. Okay. Now even C. See, anesthesia should be given after the air risk is minimized. No, they are saying if there is a risk, they should have the specialist there. That's all. So again, these two with that set one place, you can easily eliminate from the first paragraph itself. B and C can be easily eliminated. When a significant airway risk is identified, the procedural sedation anesthesia must not commence until all required special equipment needed is present. Functional procedural team members needed are present. So that means it should be deferred till you have all the tools and staffs available. So it's a very straight answer, as you all have found. All of you have found the right answer. So congratulations, after a long time that all my lovely students have got the right answer. So functioning and clean suction equipment must always be immediately available when the procedural sedation anesthesia is given. So the other two can be easily eliminated. So congratulations all of you. You have got all the right answers. So any doubts, please do clarify. If not, we'll move into the next one. Any doubts? Tangasudha is saying happy. Kalyani is happy. Good enough. Kavita is happy. Good, good, good. Thansi is happy. Shiny is happy. Good. Rachna is happy. Good enough, good enough. So because you don't have any doubts, shall we go to the next one? What is the next one? The next one is part A. And for me, it was a new thing. Chiari malformation. Okay. Or Chiari malformation, depending on how you pronounce. Okay. So that's the part A. Today, everyone got the answer correct. Fair enough, Divya. Everybody got it correct. Right. So next question. I have told you what is part A. You tell me, how was today's part A and how many minutes you took to complete today's part A. Tell me, how was today's part A and how many minutes you took to complete the 20 answers. I hope all of you are taking the printout. Write it in that given space, given area. Okay, so that you are getting used to it. Okay, you should always try to always understand. See, it should be on the aspect of getting filled on the answer in the given space. Okay, Reshma is saying tricky, difficult. Neetu George is saying tough. Kalpana is saying tricky. Okay, I thought it was a bit easier one. Fair enough. Because the answers I could easily find. Moderately easy or tricky, is it? Shiny. Savit is saying little tricky, 13 minutes. Kavita Balaji, little tricky, 14 minutes. Okay, fair enough. Sidhu saying difficult. Okay. So generally, I think after some time, the material has just made a bit difficult, is it? Let's see. A little bit difficult, Divya. Okay, but you're not telling me how many minutes you have taken. Very few students have told me. 18 minutes to do. Okay, fair enough. Right. Generally, today's material is a bit challenging. Okay. Right, now let's go and see. The material will be popping up on the screen. So what are the things that you have to always remember? I always remind each of my students, please be aware of it. You are not going to see the whole material ever again, other than that 15 minutes of window. So in that 15 minutes, they'll give you the part A. After the 15 minutes, they'll take away the part A, which will not come ever again in front of us. Okay, so that's how cautious you should be. When they tell you to start, do not waste your valuable time. Start as quickly as possible. When they tell you to stop, please do stop. But even 15 minutes is fair enough. Now, what are the things that you have to really remember? 15 minutes, 20 questions. Skimming and scanning, which is the strategy. Scanning, detail look, skimming, quick look. You know it. How much time to scan? They say 1 to 2 minutes, but I would always say 15 seconds per text, because you will have 4 texts which are different to each other based on one common theme. And today's common theme is Chiari malformations. Now, how would you skim? Generally, I used to show all the time. So now let me go with this one. So text B. CT-MRI, CM1, clinical assessment of property specialist of the individual present symptoms and either significant tonsillar impaction, tonsillar asymmetry or loss of CSF space in the suggestion of the evaluation management, MRI, spine, craniocervical abnormality, hypermobility, cervical instability, X-rays, flexion, MRI of already dynamic flow studies, complex Chiari system, recurrent after surgery, borderline equivocal cases, MRI scans of the brain, cervical sign if the individual shows no symptoms, does not even exhibit symptom infection. So here that no symptoms is very important. All the others are as such. No further investigation. So this is how it is. Likewise, you should go through A, B and C. So C is saying complication. D is saying about the symptoms that is used within surgery. So anything which is related, now you know A is about this, B is about this, C is about this, and D is about this. That's called the importance of skimming. After that, of course, you have 20 questions, which is divided into 3 types. 1 to 7 is called match the following question. 8 to 14 are called short answer question. 15 to 20 are called fill in the blanks question. Okay, now the first one, 1 to 7, match the following question. Instruction, you are supposed to write any of these letters, A, B, C, D, and you may use any of these letters more than once. And then start with the skimming, underlining keywords. Very, very, very important. Not only in the text, but also in the question. If the keywords are very prominent, you would definitely understand why keywords are important. In what circumstances is additional assessment and intervention warranted following CT? So there are a lot of places where CT and all those things are mentioned because it is there in B. Why? Imaging CT. What is the other thing that is to be done? It is clearly saying after the evaluation and management what to do. MRI or whole spine. Done. So the answer is D. What are the tripartite or tripartite classification of Chiari malformation? Tripartite means 3 types. So where are they talking about 3 types? If you really look into it, they are clearly saying Chiari malformation into 3 types. That's it. Those called synonyms. So A, which is more predisposed to myelocmeningocele or cele? Now that is the only word which is there in C, isn't it? See, it is in here. Do you really need to worry about anything? No, the question is only asking you which text. So as soon as that word is there, you go and write that place. Okay. Now benefits of surgery as a modality for managing. So surgery where? I just showed you where a lot of surgeries and all are mentioned. D. Chiari causes symptom, which is usually treated surgery, can reduce. All those things are clearly mentioned, isn't it? The surgical technique, all during surgery, the most common surgery, everything is talking about surgery. D. Through what mechanism does occurrence of Chiari malformation manifest? Manifest means what? Occur. So how does Chiari occur? It should definitely be in A, isn't it? It occurs when the part of the skull is misshapen or smaller than typical. So the answer is A. Means by which hydrocephalus is typically addressed. So hydrocephalus is where? Go D, isn't it? So that is the place where hydrocephalus is as such mentioned. Why? Isn't it? It is there. Hydrocephalus. So tube and all. So do we need to know? No need. The answer should be D. Condition posing risk to profound muscle impairment in lower limbs. So lower limb, lower part of the body, lower extremity. Where are they talking about? Definitely complication C. I'm just saying why it is. So where is it? It is there. If you really look into, it clearly says tethered cord syndrome. Is this condition the spine cord attached to the spine causes spinal cord to stretch? This serious condition of nerve muscle damaging lower body. So the answer is C. Now the next set of questions, 8 to 14, these are called short answer question, where the instruction clearly says the answer can be a word, short phrase, that means anything between 2 to 3 words, word or a number, or both. You have to by heart these instructions and the number of question and type of question. For complex Chiari, recurrent post-surgery symptoms or equivocal cases of MRI diagnostic measures is commonly employed. So where are they talking about all these? Where are they talking about all these? It is clearly mentioned in complex Chiari, symptom recurrence after surgery, borderline equivocal. So what is that? Dynamic flow studies is a three-word answer. DYNAMIC FLOW STUDIES. What surgery entails the removal? So that entails is that, isn't it? Gets removed. Okay? A little portion of surgery entails the fraction of anatomical structure to mitigate pressure and establish supplementary space. So supplementary space means provide space in order to relieve. So entails. So which follows. So what are they talking about surgery? Go to D. First and the foremost important. This is how you skim. Now the next question. Where are they talking about all these when they entail and all? So your surgeon may also remove a small portion of the spinal column to relieve pressure and spinal cord to allow more space. So all three words are there. So the answer is spinal columns. SPINALCOLUMN. In which pathology does the emergence of spinal syrinx, a cystic cavity, occur? So very keywords. Syrinx, cavity, where? Or cyst, where are they talking about? Go to C. Why? It is clearly mentioned, is it? Syrinx is here. Yes, so it should be somewhere. Now this is how you search. Okay, Chiari develops also a condition called syringomyelia. In people condition, cavity, cyst, syrinx, spinal column. All those keywords are as such there. So the condition is syringomyelia. SYRINGOMYELIA. It's called keyword reference. What is the predominant surgical approach commonly employed to address Chiari's malformation? So commonly used. Which one? Again go to D. Now which one is the commonly used one? Is the next thing that you have to really look for. So they are saying what? The most common surgery of Chiari malformation is called posterior fossa decompression. So POSTERIORFOSSA CSF stands for. So there's only one place where I mark CSF, that is in CSF is here. Cerebrospinal fluid. CEREBROSPINALFLUID. What serious outcomes can stem from spinal cord exposure to spina bifida? So where are they talking about? One particular thing. Again, complication. So don't worry about anything. Now see what are those. So spina bifida is here. So condition with the spinal cord is covering is a fully developed part of the spinal cord is exposed. Serious condition. What is that? Paralysis. PARALYSIS. This is called keywords. So what are the inherently present types? So types. Where do you go when you have types? Go straight to A. So where are they talking about types? The pediatric forms of Chiari formations are type 2 and type 3. So what are the types? 2 and 3, because types is already given in the question. Ultimate set of questions. These are called fill in the blanks question. Instruction remain very similar to short answer question. Redundancy. You should always check for redundancy. If a word is already given an article, don't repeat the article. In dash, spinal cord adheres to spine, resulting in stretching consequential severe nerves muscle in the lower extremities. See, I have already underlined that, gone through this, isn't it? This is why I told you, if you skip and see certain answers, you will see that it is getting. So in condition, the spinal cord attached spine cord, lower extremity. So which is the condition? Tethered cord syndrome. So TETHEREDCORDSYNDROME. In surgical procedure means where? Go to D. Dash customary to augment. Okay. So it is customary to allow the covering by sewing in a patch and expand space from the brain. So where are they saying the covering and all? So go to D and C. Where are they talking about? So is it saying, yes, during surgery, the covering of the brain called the dura mater, DURAMATER, for opened, and all the paths and all those swin and large covering, provide brain, everything other keywords are there. Chiari malformation arises when a segment of the dash exhibits aberrant shaping. So aberrant shaping and all is where? You know that it should be there in text A. Smaller, exerting pressure on the brain causes it to descend. So that means move downward. So text A. Go see Chiari condition, brain tissue expansion occurs when the part of the skull is misshapen, smaller, the skull pressure in the brain is downward. So where is it? Skull, SKULL. In cases where a dash, so after definitely you should remember that there should be a consonant sounded word. May be necessary to facilitate the drainage to excess fluid. It often associated with the presence of syrinx and hydrocephalus. So syrinx and hydrocephalus where? Go straight to D. Now see where syrinx, hydrocephalus and all. Syrinx is there, hydrocephalus is there. Now what are they talking about? So if you have syrinx or hydrocephalus, you may need a tube called a shunt. So is there already in the question, so the answer should be shunt, SHUNT. That's it. The categorization is contingent upon anatomy of the dash extending into the spinal canal and the presence of developmental alterations in the spine. So where are they talking about? Definitely it should be there somewhere in A. So where are they saying? Healthcare professional, 3 types. They depend on the anatomy, one of the keywords of the brain tissue pushed into the spine, also whether they are developmental changes in the brain or spine. So the only thing which is missing is brain tissue, BRAINTISSUE. The ultimate question for today, if there are no symptoms. Okay? Substantial tonsillar impaction or any cerebrospinal, no further investigation is warranted. So no further investigation is warranted. No symptom. I told you these kind of keywords are very important. So what is the only thing which is missing? Tonsillar asymmetry. So TONSILLAR ASYMMETRY is the answer. So I have wrapped my 20. It's high time that you start telling me what are your total scores, or if you have any doubts, please be kind enough to clarify your doubts, or else do shoot me your total scores. Nikki Syria, good afternoon. Anu and yes, Linju, Dan, Atira, good afternoon. Fair enough, fair enough. So do let me know what are your total scores. Kavita Balaji, absolutely good enough. Stunning 20 out of 20, and you said difficult. Very, very good. Keep it up. So this shows that how much of talent that you all have, isn't it? Come what may, you're all able to get the answers. Maria Sinnabattini, good afternoon. After some time. Nice, nice, nice. How about all the others? What are your scores? Do not worry about what others are saying. I want you to tell me what are the scores that you have got. And if you have any doubts, please do not hesitate to clarify. Anija is already saying thank you. All right, fair enough. Ivira 18, good enough, good enough. Okay. Nobody is yet to tell me what are your scores. Okay, no problem. So I hope all of you had a great session. I always do enjoy the session coming in front of you. Until and unless I meet you all tomorrow, adios to me. God bless you all. Take care. Bye.